Good morning and welcome to this presentation on how we at our institution can incorporate telehealth for the improved care of our palliative care patients. My name is Carly and let's get started. Here are our objectives for this presentation. First, we're going to define telehealth and how it relates to our model of palliative care practice. Then we are going to describe the risk and benefits of various telehealth applications. We'll detail out a training model that we think will best benefit the nurses and providers here in our program. We will assess how deployment can be successful. We're going to address privacy concerns and how a new level of technology will add a new layer of privacy. And we're also going to finalize a program on how you as telehealth consumers can continuously get support and give your feedback to us. Telehealth is the use of technology such as phones, video conferences, tablets, and computers to allow continuous access between the patient and the healthcare team. The key here is continuous access. The purpose of implementing telehealth in the palliative care setting is multifactorial. It allows patients and caregivers to feel fully supported as they deal with these stressors of advanced disease management, to have true, uninhibited, and on-demand access to their caregivers, and to enhance the expert symptom management that they need. The use of telehealth will apply to nurses, doctors, nurse practitioners, and nurse assistants to be utilized in the continuous care of our patients and their family members. In this photo here, you see that this is a smartphone device and that the either patient or caregiver is using it to access all this information to get to their provider as soon as they need them. We have demographic information, treatment information, assessment information, all in one space. There are many risks and benefits that must be considered in order to add a new level of patient care to our services. As telehealth increases, the number of face-to-face patient encounters will decrease. It's important that we understand how to have the technology available to us allow our patients to become more connected to our care and for the technology to not become a barrier to care. We don't want technology to come in between us and the patient. We want it to connect us. Furthermore, we must utilize the telehealth options. We must consider that not every patient will be comfortable with telehealth. No matter how well trained or prepared as a team we are, we're still dependent on our family member and our patient to be willing and feasibly participate in the care through this sophisticated electronic means. So our overall risks will be more patient satisfaction, saving in time, and immediate interventions, while these risks include a decrease in our face-to-face time interactions, and we are always going to be constrained by technology to some degree, and we must understand that in order to use it properly. When it comes to training, our goal is not to overwhelm you and make you feel like you're getting new tasks added to your day. Instead, we want to replace what is time spent doing valueless duties, such as double charting, driving back and forth between patients and clients, in reviewing tons and tons of messages, with more meaningful and valuable technology interventions, such as performing patient histories and assessments, education, and providing emotional support when the patient needs it in real time. Training and education will be in two separate phases. The first phase is theoretical training. It'll consist of online modules and lessons that people complete at their pace and at their level of comfort. If you want to do all of them in one sitting, that's up to you. If you want to do one each day for 2 weeks, that's up to you. These lessons will allow demonstration and return demonstration to validate the mastery of those technical skills, such as where to click to get what you need. The second phase will be a preceptor-based one-on-one training to ensure that your individual needs as a staff member is assessed and integrated into the telehealth system. Our ultimate goal of training and of using this new program is decreased time spent charting and more time spent with patients. A major strategy to successful implementation of our telehealth program will be getting our patients ready and acclimated to the new technology. Hands-on demonstration and return demonstration will be our method for validation of patient and family member understanding of this new technology. And our patients and family members, we want to make sure have the option for communication and follow-up. At the clinic, in-person visits, the patient and their family member will get 1-hour nurse visits to provide written instruction as well as nursing instruction on how the telehealth program will impact their care and improve their palliative care experience. So they'll come for their new patient visit. Everything about their new patient visit will remain the same, but an additional educational training session will be built into it, and that will allow them dedicated, uninterrupted time for them to play with the technology, use it, ask questions, and get familiar. As information technology continues to evolve, so do the concerns surrounding patient privacy and maintaining compliance with HIPAA. With regards to telehealth, there are many different facets of privacy that must be addressed. The first is how we control the environment in which we conduct telehealth care. Patients must be educated and reassured that all telehealth forms of communication will be done in private rooms that is similar to the room they have in their face-to-face appointments. We're not going to be in hallways, we're not going to be in waiting rooms, we're not going to be in elevators, we're not going to be out grabbing lunch and taking their calls and performing those assessments and interventions. The second level of controls is how we secure the information that we obtain through our telehealth applications. There's going to be a lot of uploading of information, and therefore we have to invest in a higher level of security controls. Data encryption and fingerprint key lock access will be the pinnacle of our securement for our patients' electronic information that's in our telehealth applications. We have many different goals, but the overarching goal, no matter if it's short-term or long-term, is improve efficacy of our care. The short-term goal for our new telehealth initiative is to decrease our response time to patient inquiries. With our current telephone triage process, the average wait time for patients to get access to a nurse for assessment and interventions is 65 minutes. With our telehealth program, we hope to have that wait time to decrease to 15 minutes or less. And so a saving in time, this person moving time back, that's our short-term goal. Our long-term goal is to increase our patient enrollment into our palliative care program here at this organization. As access increases, awareness improves, and comfort with technology broadens, our growth will be exponential. Growth on our program will mean better symptom management, higher patient satisfaction, and more seamless transitions to hospice care. Finally, we have to address optimization and support. The only way to keep a telehealth program successful and sustainable and to grow with the needs of our patients is to get constant feedback on what our strengths are and where our opportunities for growth are. An easy and anonymous outlet for both end users, such as yourselves, and patients and caregivers to submit critiques of our telehealth services will allow for truthful suggestions, not just positive, but we want to hear the negative. Along with continuous feedback, a simple and efficient follow-up program for technical support must be a main tenet of our telehealth applications. We're talking one click or one phone call, immediate access to the person that is going to help you troubleshoot your problems and allow for streamlined technical support process. Here are our references, and now we will open it up to questions. Thank you so much.